Hi, I'm Dr. Stephen Williams. I am a board-certified plastic surgeon here in Northern California. We do a fair amount of Brazilian butt lifts, that's autologous fat transfer, and I wanted to take a few moments to speak about potential complications and ways they should be managed from this surgery. Anyone who's been following the news and following the media, anyone who's had any interest in this procedure has noticed there's been a lot of attention about safety. And as a plastic surgeon, safety is always the first thing we think about. And that's the reason why all patients should always seek board-certified plastic surgeons, because part of our training, part of the continuing medical education is about safety. And for this particular operation, it's something that should really be thought about very carefully. When a patient is having a Brazilian butt lift, one of the biggest concerns is that the fat that we're transferring from areas like the abdomen or the flanks or the back can get into the vessels around the buttocks as we're doing that fat transfer. And that can cause very, very serious complications that can be life-threatening. Number one, find a board-certified plastic surgeon. That's almost always the first, most important step of any plastic surgery procedure, because the training, the standards that we're held to both professionally, technically, and ethically are all really top-notch, and that's what patients deserve. When seeking these practitioners out, go to a practice that does a fair amount of these, because there's a learning curve and you don't want to be the patient that particular doctor is learning on. And so you want to make sure that the plastic surgeon has had some experience in this and that they have some training. You want to make sure you're asking about the complications that they've had and how they've been managed. Typically things like where the procedure is performed, the approximate volume of fat they're planning on taking out, and the approximate volume of fat they're planning on taking back in are all really important questions. It's important that you're able to have a dialogue with your plastic surgeon to discuss expectations, risks, benefits, and alternatives. When a patient seeks a non-board certified plastic surgeon, sometimes for discounts, sometimes they know a person who is maybe in another specialty, the concern is that sometimes the results are suboptimal. And a lot of times patients do this to try to save some money. In order to do this procedure safely, it takes a certain amount of time. That procedure also requires a number of professionals around us to all make sure that we're taking great care of the patient. That means potentially an anesthesiologist who should also be board certified. It means nurses and techs. It means that someone to process the instruments and handle the fat, make sure things are handled in a sterile way. All those things take resources. And so while it's tempting to try to find the cheapest service in town, at the end of the day, it's your health. And doing this procedure the correct way, the safe way, requires some resources and requires some cost. In our practice, and for ASPS members who are board certified plastic surgeons in general, the complications we see from other providers include unevenness, infection, wound complications, drainage, all those things. And those are just the smaller complications. When patients have those, as a plastic surgeon, sometimes the corrections can be more challenging than the initial surgery. Sometimes we have to perform multiple operations to provide drainage or to remove fat that hasn't survived or to try to improve the contour. It's not worth it. Your health isn't worth it. The complications that can occur aren't worth it. It's always best to minimize those complications, and part of that is going to a board certified plastic surgeon. Thank you very much. I hope this is helpful.